Good morning everyone. I am Dr. Satyavrat Sahu, MDDM clinical pharmacologist, and today I am going to discuss on respiratory syncytial virus. Respiratory syncytial virus is a contagious virus. It is like the flu virus and other COVID-19 virus, and it is a form of pneumonia, and this virus can be transmitted through droplets and inhalational route also, and it can also transmitted through kissing to any RSV infected person, or there are lots of routes of transmission of this virus. Respiratory syncytial virus, it affects, it can affect your lungs. There is the symptoms will be rhinorrhea and sneezing, and due to involvement of the lungs there might be dyspnea, breathlessness, that is called, and other lung infection can lead to also severe manifestations, and in that case, if there is severity, then the patient has to be admitted in the hospital and managed properly according to the respiratory syncytial virus guideline. And respiratory syncytial virus uh, present anywhere in the environment, and when it enters to the from it is transmitted from the patient to the other person who become the contact of that patient. It can affect that person and leads to some manifestations of respiratory syncytial virus. And there are lots of complications can occur in respiratory syncytial virus. It can affect the mostly the persons those are immunocompromised, like diabetes, chronic kidney disease, uh, those who are having lung disease, or those persons who are having some liver pathology, cardiovascular pathology. In that case, this virus affect them more than the normal healthy persons. And there are lots of drugs also approved for respiratory syncytial virus, like one monoclonal antibody. There is Palivizumab. Palivizumab is approved for the management of respiratory syncytial virus, and other antivirals can also be taken according to the guideline of respiratory syncytial virus. Nowadays, also in USA and in foreign countries, there are approval of respiratory syncytial virus vaccines, but in India there are not any vaccines of respiratory syncytial virus. So there is need of research on respiratory syncytial virus vaccines in India, and we can also uh, try for newer drugs development in India also, and to prevent respiratory syncytial virus, we should maintain our hygiene, personal hygiene maintenance, always remain clean, and before eating foods we have to thoroughly wash our hands, thoroughly wash our face, mouth, and we should remain uh, we should avoid the respiratory syncytial virus patient's contact during the transmission period, and if we have also suffering from respiratory syncytial virus infection, then we should be isolated for some days of the duration of incubation period. Till the duration of incubation period and transmission of the virus, we have to isolate for that period. Then we can prevent the transmission of this virus. And the respiratory syncytial virus, it can cause lots of complications if it gets severe in some patients, and it can lead to respiratory distress and lung damage, etc. And vaccines are mostly important for development of immunity against the respiratory syncytial virus. So this respiratory syncytial virus is now more and more prevalent in everywhere in this world, and the proper management of respiratory syncytial virus should be done, and proper investigations of respiratory syncytial virus should be followed, and according to guidelines of respiratory syncytial virus, the patients are to be managed properly so that they can live a healthy life. And this much for today, and we will discuss later on this topic briefly. And you can also get some idea from articles from outside, articles from journals published in the journals, good journal, reputed journals, and also you can get some idea from guideline. If there is published in any guideline about respiratory syncytial virus, you can search it in the Google site and read it. Then only you can improve your knowledge about respiratory syncytial virus. And please like and share my channels, and like and share my videos, and subscribe to my channels, so that you will be able to know about lots of diseases, other diseases and drugs and their managements, and you can gain some knowledge about diseases and drugs used in these diseases. Please like and subscribe my channel. This much for today. Thank you very much. Jai Jagannath.